We have a call right now from Nancy in Edders. Welcome to Smart Talk this evening, Nancy, and what's your question or comment for the panel?
Well, I could relate to Kim, and I was treated for breast cancer, and now I'm trying to decide whether to have my ovaries taken out, and it's not really clear-cut. I've gotten different opinions. And I was negative for BRCA1 and BRCA2. So, you know, I just wondered, and I had gone to Johns Hopkins for, when I was originally diagnosed, for a second opinion, and I contacted them, and they said that now sometimes they're giving women Lupron to kind of put the ovaries, you know, to sleep, and I was wondering what the doctors thought about that.
Nancy, thanks so much for your call this evening. Dr. Williams.
Having an oophorectomy, a total abdominal hysterectomy, having the ovaries removed can be both therapeutic, it can be preventative. How old are you, Nancy?
53.
The majority of breast cancers are hormonally sensitive, and by that I mean estrogen and progesterone positive. If you have not gone through menopause, the largest source of estrogen production in your body are obviously your ovaries. Removing that source of estrogen can be, that is what the injections, the Lupron injections, accomplish, is a surgical, a non-surgical oophorectomy. If you have already gone through menopause, the likelihood of having your ovaries removed to be helpful, well, it would not be helpful. In fact, generally, I think the consensus is in women who are not BRCA carriers that having without the BRCA gene, even if they had breast cancer, is not associated with an increased risk of ovarian cancer.
I just wondered if you wanted to weigh in there as a geneticist.
Well, certainly we can see an increased risk of ovarian cancer in women with breast cancer, but most of that is due to the association with the genes increasing the risk for both types of cancers. But if you look at the risk factors for breast and ovarian cancer, they share a lot of similar risk factors, such as how old a woman is when she has her first period, whether or not she ever stops her cycles throughout her lifetime, whether she goes through an early or late menopause. So there is a general rule of thumb that if a woman develops breast cancer, that her risk for ovarian cancer doubles and vice versa. But yet the impact is much more significant if a woman carries a BRCA mutation.
But you can see these tough choices cancer patients face. Sometimes to be proactive means taking away some other options that you might have, such as childbearing. But we have another call. We want to move on. Thank you so much, Nancy, for calling. We appreciate that, and good luck with your fight with cancer. Mildred is now joining us on the phone from Rock Hill Furnace. Welcome, Mildred, and what's your question or comment tonight? Hello, Mildred.
Hello?
Hello. What's your question or comment tonight for Smart Talk?
Yes. I had breast cancer in 2009 of July, and I had a lumpectomy. And I have a lump that fills up with fluid, and I get the fluid taken out of about every 3 months. And my gynecologist seemed to think it's going to be more cancer.
Oh.
But excuse me.
I'm sure, Mildred, I'm sorry to hear that, and hopefully the doctors here can offer you some reassurance. Let me just see if Dr. Hempling deals with a lot of women who have issues with cancer. Doctor?
What I hear you telling me is that the place they took the cancer out of is collecting fluid over and over again. Is that correct?
Yes.
And they keep taking the fluid out?
Yes.
Have you been back to see the doctor who took out the lump?
Yes, I go every 3 months. And I'm due to go there this next week.
I wonder if it might not be a bad idea to ask somebody else.
Mildred, he's saying get a second opinion.
Okay.